Thank you, Alison, and thank you for the opportunity to speak to you all today. I'm going to talk to you about another exciting program that ANZGOG has brought to Australia and is leading in raising the awareness of ovarian and gynaecological cancers in Australia. This is another international collaboration because Survivors Teaching Students was a program that was actually developed in the US in the early 2000s, and it was developed by a woman who was diagnosed with ovarian cancer after a difficult and long trajectory in trying to get the doctors to pay attention to her symptoms. And she thought about how am I going to change this for the future so that we can get more timely diagnoses of ovarian cancer and get women into treatment and potentially better outcomes for the future. And she thought the way to do that is actually to speak to our medical students. Let's go and talk to our medical students while they're in the baby doctor stage, when they're still receptive and open and interested. And let's go and talk about something that not too many people talk about. Let's talk about ovarian cancer. Let's talk about listening to women when they come in and say that with their gynae symptoms and say that these symptoms aren't usual for me, as to follow on with Claire's words, persist, persist, persist. And our message to the doctors is if a woman comes in with persistent gynae symptoms, we want you to persist as well. So as you see here, we have our lovely Kristen, who's going to follow me as well. Kristen is our regional coordinator for the Survivors Teaching Students program here in Brisbane, and this afternoon really is the launch of our program in Brisbane, and we're actively recruiting volunteers to come and join our program, and hopefully when I finish speaking you'll be interested enough to put your hand up. So, what is Survivors Teaching Students? It's very straightforward. It's going into the classrooms of our medical and nursing students and telling your stories, because each of your stories are unique, and in each of your stories you've got learning experiences that if you reflect on, you will be able to take forward and share with those doctors of the future to take into their own practice. And as Claire so eloquently showed us before, ovarian cancer is not just one disease, it's actually many diseases. So in telling all of your stories, you are able to bring those lessons into the classrooms of the medical students. I should say here also, although ovarian cancer is the primary focus of this flagship program, that we at ANZGOG, we cater for all gynae cancers, and so this program is open in Australia to anybody who has a gynae cancer, either who's been diagnosed with a gynae cancer or is a caregiver for somebody who has ovarian or gynae cancers. So it's important to spread the message and emphasise our key message of when a woman comes in with gynae symptoms that are persistent for her and they're persisting over time, that the doctors have heard of this before, they know to investigate appropriately and who to refer this woman to so that she gets into treatment in the shortest possible time frame. So our goal, as it says here, is to increase the number of healthcare providers who recognise the signs and symptoms of ovarian and gynae cancers so that we can diagnose this disease as early as possible. And we started giving presentations in Sydney last year in July, and already the feedback from our students has immediately showed that their awareness is raised. Some of the comments are it's really been important for them to have a face to this disease. It's not just a collection of symptoms, and also having the caregivers present, it really reminds them that in this day and age we're looking at a person-centred model of care that includes the family, and it reminds them of the effect that this disease has on the whole family. So the important thing about Survivors Teaching Students is that it's a volunteer-led program. It's your program. My role is to develop it across Australia, and we're starting in 4 states, which I'll elaborate on shortly. But it's important to understand that this is a volunteer-led program, and we really value the time that you're giving, and that you are generous and courageous to share your stories, because you are really making an impact. We have a number of our regional coordinators across Australia in New South Wales, Victoria, Brisbane, and earlier on, but Helene had to leave, we had our original coordinator for New South Wales as well. We also have a number of women in the room, and I thank you very much, who've already joined the program, who've been working on their stories and who are ready to present. So, as I said, the program started in the US and it was very quickly taken up by Canada, and then about 4 years ago it was taken up in the UK as well. And it was brought to Australia and brought to ANZGOG by a young woman who was being investigated for infertility shortly after she was married, as they were trying to have a family. And in the process of that investigation, she found that she had ovarian cancer. So she was diagnosed in the UK, but just as she was diagnosed, she had been offered a position in the US. So she actually moved to the US and she was treated in the US for her ovarian cancer. And it was in the US that she came across the program Survivors Teaching Students. She became a presenter and a facilitator, and she saw firsthand of the impact of this program on the medical and the nursing students, and also the value for the volunteers and the other presenters that were involved in the program, of how important it was for them to share this message as well. And she saw that each and every one of the courageous women and caregivers, who could be men or women, who were working in this program, were doing important work. They were all like precious stones that were throwing into a pond, and the ripples that were going out from that pond, they perhaps may never see, but their messages were going, the doctors of our future were going to always remember. And as the program has been going over time, particularly in the US, it's not unusual for doctors who, like our doctors who've presented before, Dr. Alison Brand or Paul Cohen, the US experience is that many years later, people will come up to the parent body organisation in the US and say, it was because I heard a woman or a caregiver tell their story of ovarian cancer when I was a med student that I decided to work in this field. And for us at ANZGOG, that's a very important part of this program, is that we're encouraging the doctors of the future. So in the interest of time, I'll just skip forward a bit. So our goals for the program, as you said, is to build an understanding of the impact of ovarian cancer, to help develop an appreciation with the doctors of what it's like to live with this disease, and to provide insights into listening to family concerns, and importantly to enhance communication skills with our young doctors when dealing with this very sensitive topic. So how it works very quickly, once we establish a relationship with the university, we appoint a regional coordinator in that city, and as I said, we have a number here before. They're going to a number here in the audience. They're going to come up shortly and we can have some questions with them as well. Then a facilitator is actually appointed to each of the universities, because in some cities we're working with more than one university, and then that facilitator starts building her team around her. Presentations are 1 hour and they're designed to plug in easily into the curriculum in the medical schools or lunchtime learning or seminars. And we always have 3 presenters telling their stories, because in presenting more than one story, we can show the diverseness of the disease. We also have question time, and it's in that question time that you get an opportunity to elaborate further on your story and provide some further insights. So just some quotes from some of our students in the presentations that we've already given, which show powerfully how important this program is. That hearing these stories reminds me of why I set out to do medicine in the first place. Thank you. And it shows the gratitude of the students in you sharing your stories with them, that the patient and family perspective is really important, and they're honoured for the chance to hear these stories and for the brave people who share them. And we've been able to show in our evaluation of the students that hearing your presentation increases their knowledge and awareness by 40%, and that's a significant change. So the key to the success of the program is that we need to grow a strong network of women and caregivers across Australia who are prepared to work in the program. We help train you to do the presentations, and we support you. And there's a wonderful sense of camaraderie and support amongst each of the presenters together. And I'm sure that I'm seeing nods in the audience from our regional coordinators, and that's lovely. And they'll be able to share that experience with you as well. And as this presenter said to us, that she really values the enthusiasm and commitment of her fellow presenters, the facilitator and the regional coordinator, and the great support from the other members who show up to watch, and that's very motivating. Also, we have had such interest from the medical schools around the country that we can't keep up at the moment, but we're working hard in New South Wales, Victoria, starting here in Queensland, and then we'll be moving to WA later on. So thank you very much.